all. Today I am going to present clinical and demographic profile of oculoplasty patient in a newly established tertiary care center. So the background, the oculoplastic disease include the eyelid, lacrimal and the ocular surface condition that impact the vision and cosmetic appearance. Studying their pattern helps improve the patient care, especially in a newly established tertiary care center. So the aim of our study is to evaluate the clinical and demographic profile of oculoplasty patient presenting to a newly established tertiary care medical institute. It was a retrospective study conducted from 2001 to 2024. Patients attending the ophthalmology OPD were included. A total of 679 patients were categorized into four major groups, that is the eyelid disorders, lacrimal disease, ocular surface disease and the orbital tumors. The clinical, demographic and the treatment modalities were analyzed. So to our results, 676 patients were enrolled, out of which 292 were the females and 384 were the male. A majority of the disease fell under the category of eyelid disorders, followed by lacrimal, ocular surface disease and the orbital tumors. The eyelid disease is mainly comprised of the lid tear repairs followed by collagen, and the list goes on. There are the few examples of lid repair followed by collagen. A total of 105 collagens were done. Cysts were removed around 28. Ptosis surgeries were done in 20 patients, 13 with the sling and 13 LPS resection and 7 with the sling. We also were able to do the congenital ptosis repair. So there were also cases of dermoid, sarcoid in cases of lid, and followed by entropion surgeries, that is 18%. This was the pre and the post operative outcome. So the lid masses were also noted, like for this example, the lady showed a right eye, upper and the lower eyelid, benign melanocytic levers and a rare entity of hemangioma in the left upper lid. The lacrimal disorders consisted of 224 patients, in which majority fell under the category of syringing and probing, followed by external DCR, canalicular tear repair with mini Manoka. So this is the example of one of the patient with mini Manoka. So the orbital surface disease, there were a total of 111 patients. Pterygium surgery was done in total of 102 with in which 97 were with graft and 5 were without the graft. Conjunctival cysts were noted in 9 patients. The orbital tumor, total of 8 patients were noted. Like for example, this 5-year-old boy came with right eye proptosis and we were able to diagnose the right eye glioma. There were few surprises. This was the subcutaneous zygomycosis displacing the globe lately, which was further referred to higher center for further management. And to our surprises, there were few children in the trauma center coming to us with wire and injuring the conjunctiva and the lid. The repair was done internally, and this is the post-op image. So to discuss the eyelid disorder most frequently, that is 45 to 55% in the literature. Lacrimal disorders are significantly higher in prevalence in Asia, and the orbital tumors are rare. So these are all the findings corroborated with the studies which have been done earlier. And to our surprise, the pterygium was more in this area since they are more exposed to the UV rays. So the limitation was it was a retrospective study, referral bias and short follow-up. So to conclude, eyelid and lacrimal disorders form the bulk of oculoplastic workload. Findings align with the national and international data. A newly established center, standardized protocols enable the effective management despite the limited sources, and there is future need of subspecialty strengthening in orbital and complex lacrimal surgery. Thank you.